Hey, Barry McCullers here, Rockstar Doctor. Has been treating me right. It's been 48 hours since I've last reported in, and first thing I can tell you is I've lost 11 and a half pounds. That's not 10, that's not 12, that's 11 and a half. And first day, a lot of pissing like a racehorse. Second day, not so much. Either way, the weight is coming off, and the energy's there. I'm not jittery. I haven't been too hungry. I've been eating what I would normally eat for a snack over the course of 10 hours in a day. I seem to have slept a little bit better than I normally do. More restful sleep. Kind of. If I could explain it, I feel like I'm falling deeper into the bed. If that makes any sense. Today we're going to be taking my second ever injection of HCG and my vitamin B12 shot. So the first thing that we always do is keep them in a bag. I do in the refrigerator. Kind of want to warm them up to room temperature. And then I've got my vitamin B12. Try not to get your fingers all over this stuff up at the top, and always use your alcohol pads to clean off the top, wipe away from where you're going to stick the needle in. Make this clean. Your needle's going to be clean. Make sure your injection site's clean. That's pretty much the only thing that I can see is being real careful when you're pulling these injections out. You pull your 2 milliliters here. There's a little trick, to get all the medicine into one needle, so you don't have to take 16 injections a month, just 8. I'm a little bit of a Girl Scout when it comes to this. I know I can probably poke myself in a lot of areas. Another thing is the thyroid medicine seems to make me feel like, I've been to the gym, but I haven't been to the gym. But, I feel, kind of stronger. Like, instead of, pulling my arm up and not feeling any muscle, it's like I feel it. So I feel like I'm a little bit toned. And obviously I'm a little bit hyped up. So what I'm going to do now is tell you, get in where you fit in. You know what I mean? Health's the new wealth. How healthy can you afford to be? So I'm going to bring in my trusty shot giver today, because I'm not yet doing this myself. And he's going to give Steve is going to give a demonstration on how to draw the medicine and kind of be proactive.
That's the order, right? 2,
Yeah.
1.
2 and 1 with cleaning these off the prior. How important is it to do that every time?
It's very important.
It's very important to do that every time.
Do you have a particular place that you like?
I don't know. Do you want to use the same swab? Is that, I guess it's all alcohol,
Oh, yeah,
right?
it's all alcohol. There's nothing living on here whatsoever.
Okay.
Okay.
So the main thing at this part of the program, if you will, is not being intimidated by following procedure. These are sanitary environments. We're using alcohol swabs. We're not on our first date when it comes to drawing out the medications and knowing exactly how to do it. And the shots are virtually painless.
So what you're going to do is draw the needle up a little, create an air pocket in there. You're going to go into the needle. You're going to pressurize, and then you're going to pull it down, and the medicine will come down into the needle itself. It's giving me a little bit of a spot of trouble here. So we pressurize up, insert the needle, we add some air, and we pull down, and the juice is coming right into the needle. Does Ernie have the same problem? You know what sucks? Oh, They shouldn't have this label on all the way around. You can't see into the bottle if you get above the level of the fluid.
It's kind of like using the last bit of your Windex, you know what I mean?
Exactly. So it's a little easier. We're learning as we go. We keep the bottle here on its side. We pressurize up a little. And as we pull down, we can see the stuff coming into the barrel of the needle. We're doing much better this time.
That's 2, and the vitamin B is 1.
So we're going to get right down to a little past the 2, just a little past the 2.
And always keep in mind that it's very important not to, what they say, adulterate the vitamin B12 by putting any of the HGC into this bottle while you're transferring the air and etc. Very important not to have any of that in here and none of this in there, that all of it mixes within the needle. The reason it's so important is it saves you 8 shots. I mean, you could literally do 1 needle of one and 1 needle of another and this would all be over. But we want to be efficient. We want to get this down to where it's just maintenance. I come down and eventually I make these shots myself. I pull them out, I load them up, I stick them in my leg, I pull the plunger, and I'm on my day. But we're just not quite there yet.
Yeah,
I'm working up to it.
And just because it's taken an extra minute here, you don't need to be concerned. Okay. So we're directly at 2. You punch the needle there. You just saw the bubble go up to the top. And I'm just going to there. And you see at the top of the needle, we've emitted a drop right there. We're going to waste that drop, but there's no air inside the barrel of the needle. The needle's nice and clean. I'm going to wipe off any material there, and we're going to go into bottle number 2.
Correct.
And bottle number 2, we're going to pull it right up to 3. We're not going to inject any medicine in there. It's an airtight entrance. And now we're pulling down. This will be a different color, and this bottle is much easier to work with because you can see the side of the bottle.
I'll make note of that in the future.
Right. And we're right at 3. And pull the needle off. We're going to tap it. And again, we're just going to, just that much at the top, and this needle is ready to go. So, in order to install it, the trick is pretty simple. You turn your head. We're going to bunch them up a little bit. We're going to go down with the needle. I won't inject you till I tell you that I'm going to do it. And then the trick is to hold the needle with your fingers like this, so when you push the plunger down, you do not push the needle further in and cause any unnecessary discomfort. So you're going to learn to hold the needle up and just push the plunger down. It's very, very simple. Do not plunge it too quickly or else you'll cause discomfort. And you hold this in your hand a minute, just like that, to warm the material to body temperature. Okay, because it comes out of the refrigerator, it's cold, just makes the injection more pleasant. Okay, these needles are a one-time use only, and you have to disconnect the syringe. It just unscrews. So we are going to bunch up. Barry's going to take a little breath. And we're in there, and I'm just pushing down the fluid. We're almost done. And I could do it a little faster. I'm just trying to be extra considerate. Now here's the trick. Just pull it out gently like that, and you're done. Do not whip it out, because you'll suck a little bit of medicine out with the thing, and that can cause a bruising.
Well,
Here we go. 1 second. We're going to put the cap on top of the needle, and then we unscrew the syringe from the needle. The needle is disposed of in a medical disposal, and this here is pulled apart, and it can be disposed of as well. Please be careful of your needles. And that's it. Barry, how you feeling? Okay?
That is remarkably, again, painless. I mean, when you look at the thing full of all that juice and all that stuff, I mean, it's always an interesting thing, but It takes me about a minute from when I get the injection to hit the B12 or whatever else, the HCG. But I can feel right now, it kind of seeping around, like I'm getting a little bit amped up a little bit. But the next time we're going to talk is going to be right from Dr. Wilcox's office. We're going to meet Dr. Wilcox's angels. We're going to meet the great doctor himself. We're going to do a couple of scenes. I'm going to take some measurements so you can see how much fat I'm really losing. And until then, health is the new wealth. Drink lots of water and stick to your diet. And don't go changing.
Hey, I got a question.
What's
for you.
that?
If you had to get these 2 injections over, would you take an injection from your webmaster or from me?
It doesn't matter. They
So
both were
both
the
of them
same.
were just
They both
fine.
were equally qualified to give me that shot. So I
Even
would
though
say
we're just regular bunglers, you've experienced no pain with that needle.
the most pain I've felt so far is I can't think of any. I've been a little bit hungry and I need to drink a lot of water. Other than that, it's health's the new wealth. See you tomorrow.
We'll look forward